So if you follow my channel, you know that a week ago I rescued a kitten named Small Fry and her family. Small Fry is a 3-week-old kitten who weighed about what a 1-week-old kitten should weigh. Completely emaciated and dehydrated, we were very concerned that this kitten was on her way to dying. I showed you her rescue video, so now I want to show you guys all of the tremendous progress she has made in just 1 week. As you can see from these photos, she came to me very dehydrated and underweight, weighing in at only 170 grams at 3 weeks old. She had severe respiratory problems that were preventing her from being able to nurse, so she wasn't consuming anything at all. The morning after her rescue, I took her and her whole family to the vet.
It's okay. You're okay, Mama. I know. I'm taking you to the vet. Help everyone feel better.
Neonatal kittens' bodies are fragile and complex, so it's important that you find a veterinarian that's comfortable with pediatric health. Small Fry's veterinarian performed blood tests, x-rays, and other physical exams to determine what was going on and what the best treatment path would be for her. The prognosis was not good. With all of these cards stacked against her, we knew it would be a difficult recovery for Small Fry. One issue that the x-ray showed is that instead of being full of food, she was actually full of air, a sign that she was in pain from gasping because of her respiratory issues. Because of these challenges with consuming food, the vet decided the best thing for her would be to tube feed. Tube feeding is an advanced skill, and it is not one that I will be teaching over video. I recommend that if you're caring for very sick kittens, you learn this in person from a vet. Seeing a vet is also important because they can prescribe very small amounts of antibiotics and other medications that your kitten will need. Some medications might be administered on site. For instance, Small Fry was given injections of iron and B12. But then we were also given 1 pain medication and 2 antibiotics to bring home. Antibiotics are such an important part of helping kittens with respiratory issues recover, so please make sure you're seeing a vet who understands that you can medicate young kittens in very small doses. Another important thing is to keep the airway clean, so if a kitten has a crusty nose, you want to use a warm towel to keep that area nice and clean. I also continued subcutaneous fluids on her twice a day to keep her body hydrated. Between all of the medications, the supplements, the nursing care, and the tube feeding, she actually started to feel a little bit better. 4 days into this care, I noticed something incredible. She was starting to try to nurse.
Good job, Small Fry. Go, Small Fry. Go, Small Fry. Go, Small Fry.
This was an absolute game changer. It meant that she was feeling well enough to breathe, well enough to want to eat. She would be able to get all of those great nutrients from her mother's milk. I continued with supplemental feeding and fluids until it became clear that she was able to get all of her nutrients from her mother. 7 days later, she's almost unrecognizable. She has nearly doubled in weight. She's feeling fantastic. And as one person said, she's not really a Small Fry anymore. Now she's more of a baked potato. She's not fully recovered yet, and she still has a road ahead of her. But this is such an awesome testament to what is possible when we just try. When we just try to protect those who are the most vulnerable, and we don't give up on them just because they're small or just because they're sick. Small Fry and others like her are worth it.
Small Fry?
What do you think? You're doing a good job. Growing big and strong. Hard to believe this kitten was completely emaciated 1 week ago. A week ago, she was only 170 grams. Now she is 305 grams. In 1 week, Small Fry has doubled her weight. You grew a whole other kitten. Look at you. Good job, Small Fry. You're doing so good.